Dear colleagues, today we are in the city center of Munich in a dental practice of Professor José Gonzales and Dr. Markus Engelschalk. And we're going to make an interview with Professor Gonzales and discuss interesting topics in periodontology. Professor Gonzales, thank you very much for the invitation.
Thank you very much for this opportunity to speak about periodontology. This is my specialization.
My first question is, how did you decide to make the specialization in periodontology?
This was always my special interest. You know, when I was studying dentistry, then I was always thinking on what type of area of the whole dentistry was more interesting for me and where was my focus. And this was very difficult at that time because, you know, when you're studying, you have to have an overview of everything, of all areas and all topics. But when I had the first lessons on periodontology, I was fascinated about the links between our mouth and the whole body, and also between all the mechanisms, you know, and the microbiology and the immunology and these medical aspects. This fascinated me from the very, very first beginning. So I knew it is a very difficult topic because, you know, it has a lot to do with medicine and with microbiology, with genetics, immunology. But on the other side, it is exactly what I wanted to learn and what I wanted to know, you know. So then when I finished the study, I just simply knew that I have to work on periodontology for my life.
You're a specialist in periodontology. You also made a fantastic career in Germany in the section of perio. And
thank you very much.
And you also have some dental practice concept in your practice here. So what do you do? How does it look like when you have a periodontal patient? What do you do? How do you follow the treatment?
That is a very good question because, as you know, every patient with periodontitis is a unique patient. This is always something that you have to check before, and the normal steps or the normal protocol that I am using is the patient. You see the patient the first time in the first appointment, and then we do the periodontal recording and assessment, and we do with special charts, periodontal charts on the computer. It's called Parostatus. It's a specialized program here in Germany that you can afford in internet, and then you can do the periodontal recordings, and you assess the periodontal parameters, and we take an X-ray, a complete orthopantomogram. So it's a digital one. And then you make the diagnosis, the periodontal diagnosis, and you speak this, you communicate this to the patient. Okay. So this is the first step. And the second steps, so in the protocol that I am using, is then to bring up a good oral hygiene so that we have some reduction of the oral plaque and of the bleeding. And this is done mostly in Germany by the dental hygienist or the specialized prophylaxis assistant, and this is done by them. And this requires I don't know, 1 or 2 sessions in order to correct this situation with the oral hygiene. And after that, then you decide what type of treatment is necessary for the patient, if you will do some normal periodontal treatment, or you need to do, it's better to do a full mouth disinfection. And you can also decide in very severe cases if you also will do a treatment with antibiotics, with systemic antibiotics. And this is what I am doing in the clinic.
And what about the follow-up? If you have a patient with periodontitis, but he has also some problems with fillings, or you have to do some fillings, you have to do some prosthetic treatments, how does it look like? What comes first? What is the next step, and so on?
Yes, that is like this. We are trying to correct the problems, the local factors in the mouth. So before the treatment of periodontitis, it is necessary to make the fillings and to correct the fillings, yes, and to eliminate the caries. And then after this, you do the periodontal treatment. But of course, periodontal treatment always before the prosthetic restorations, before using crowns or bridges or implants for the prosthetic restoration of the patients. This is completely necessary. It is a must to do first the periodontal treatment.
Okay. And when do you do the re-evaluation?
The re-evaluation is a very important step. And in my clinic, I am doing the re-evaluation about 6 to 10 weeks after the treatment. And then after doing the re-evaluation, by assessing all the periodontal parameters, then I take the decision to perform a supportive periodontal treatment on a regular basis, forever, or to perform some type of regenerative periodontal treatment using proteins like the emdogain, for example, or enamel matrix proteins, or using also some type of membranes for doing guided tissue regeneration. That depends also every time on the specific situation of the bone defects, yes, or just simply performing a supportive periodontal treatment. The decision about the frequency of this supportive periodontal treatment is always based on the clinical parameters that you assess during the re-evaluation, after the complete anti-infectious therapy or after the regenerative therapy, periodontal therapy. And you know, just giving some type of tips, it is clear if you have at the initially, if you have a severe case, a severe periodontal situation, then it is necessary to perform a supportive periodontal treatment every 3 to 4 months. But if you have initially just a more liked periodontal situation, periodontitis, or like a moderate periodontitis situation, then you can perform a supportive periodontal treatment every 5 or 6 months. However, I just can recommend that every patient that has a periodontitis and that visits to you because of periodontitis that at least 2 times a year you have to perform a reevaluation, and the patient must have a supportive periodontal treatment. Better every 4 to 3 months.
Professor Gonzales, what can you advise to young people, students of dentistry?
That is very, very important for me, because I think that in the dental study, you have to always have also a focus on the medical aspects of the health and diseases and of the organism in general, and that is also my advice to the students, that together with all our possibilities to restore and to maintain the teeth and to keep oral health, that it is also very important for all of us to consider the aspects of the whole body, the health of the organism, in order to understand it well and to treat it well and to have a wide overview of what is happening with our organism. That's my advice.
Professor Gonzales, thank you very much for a very interesting discussion.
Thank you.